Many workers have left the sector or returned to European homes after Brexit or refuse to work within the government's forthcoming demand, a double vaccination. What is this doing to those who need care and the families who look after them when no one else can? Lewis Goodall reports now from Yorkshire.
You've heard about fuel, about CO2, about turkeys. But there's one shortage, which is perhaps more disturbing than any other. It's the now dangerous lack of staff for social care. At this facility in Stockport, a home for those with severe learning difficulties, the problem is stretching a workforce already depleted and depressed.
Recruitment is really challenging at the moment. We've had adverts out and we're having to relist the adverts because we're just not getting the applicants through. And it's not that we're getting applicants through and they don't have the right skill set or the right values, we're just not getting applicants applying for roles. I've got vacancies at the moment and I'll check each week and there's no applicants.
None at all?
None at all.
And the problem is that care for such vulnerable people without the right number of people around them starts to become dangerous.
It involves asking staff to pick up overtime, staff that maybe have worked 6 days in a row, we're asking them to pick up a 7th day, but there's only so long that we can rely on that for.
It's not sustainable.
It's not sustainable, no.
Why such a shortage? Well, there's a perfect storm. This is skilled work, not easy to replicate. Many have left care because of the horrors of COVID. Brexit means the sector can no longer rely on European labour markets, and other industries can offer rates of pay with which at least care homes like this one, that are reliant on local authority funding, cannot compete. And the new money via national insurance, announced to much fanfare by the government, is a distant prospect.
The government have said in 3 years' time, then some of the national insurance rates will come to social care. We have a crisis now, today. Our colleagues should be paid at least £12.60 an hour, and they're paid national minimum wage. That is what the local authorities are paying us to be able to pass on to our colleagues in most circumstances. We can't wait 3 years.
And on the 11th of November, a new problem will arise. The government will introduce a vaccine mandate for those working in care homes.
It makes joining a sector that is already not massively attractive even less attractive. I have written to nearly 30 people in the last week explaining that as a result of the change in legislation, we won't be able to employ them from the 11th of November.
So 30 of your
30 people, yeah.
And it seems unlikely you're going to be able to fill them or fill those posts.
Absolutely not. Today I've got 512 vacancies I'm trying to fill. On the 11th of November, I'll have another 30 on top.
In England, the percentage of staff in care homes for the elderly who have received 2 vaccine doses is 87.2%. That's of the 7th of October. That should go up a bit by November the 11th. But remember, this is just an average. In some places, the figure is much worse. In Lambeth, it's 80%. In Luton, 79.6%. In Manchester, 75.9%. And in Birmingham, the figure is 75.2%. Again, first dose figures are higher, so that should increase by the deadline, but there are going to be gaps. The government's own projection suggests 7% of the workforce will not be double jabbed in time. That's 40,000 new vacancies on top of the 112,000 which already exist. We've spoken to other families who are being refused care homes which are barely functioning. Some whispered darkly about the idea of bankruptcy as a result of losing income, staff and residents. Make no mistake, this is a real crisis. And the danger is that it's the wealthier homes in wealthier areas for wealthier people which can weather this storm. And it's the poorer ones in poorer areas for poorer people who can't and who suffer most. How's that for levelling up? In the darkest days of the pandemic, many spoke of social care finally getting the esteem it deserves. And yet, it feels more distant than ever.